Endometriosis inhibits fertility. Around 1 in 10 women that are infertile are unable to conceive because of a condition known as endometriosis. The condition itself is a relatively common malady, affecting around 6% of women in the United States. Some women can still conceive normally or with only mild issues, even with this condition, but between 30 and 40% of women with endometriosis are unable to conceive normally. Women with endometriosis are considerably more likely to be infertile than their peers, as infertility afflicts only 10 to 20% of American women as a whole. Endometriosis is a condition in which the uterus functions abnormally. The endometrium is the inner lining of the uterus and goes through a pattern of development and shedding along the pattern of the menstrual cycle. In women with endometriosis, the lining of the uterus grows thicker than normal, sometimes so thick that it invades other areas of the female reproductive system, including the pelvic cavity, ovaries, and fallopian tubes. Endometriosis can inhibit fertility because of the various ways that this lining can suppress the normal function of the female reproductive system. For example, it may lead to blockages in the fallopian tubes. It also increases the risk of infection and scarring of the reproductive organs. The endometrium also has hormonal influence, which can inhibit the normal and healthy menstrual cycle that is conducive to pregnancy. Ironically, one of the best treatments to improve fertility for patients with endometriosis is the birth control pill. The fertility-suppressing mechanisms of the birth control pill also limit the issues associated with endometriosis. Because endometriosis is a cumulative condition, which gets worse the longer that it is allowed to go on unimpaired or unimpeded, the patient can stop using birth control when she wishes to become pregnant, and her body will be more receptive to fertilization than it would be otherwise. Surgery is also an option if the patient is experiencing structural issues such as blockages resulting from the condition. Many women opt for in vitro fertilization that suffer from endometriosis. Other physiological issues which can impact female fertility. A minimum of 10% of fertility issues are the result of the malfunction of the uterus or a malformation of the organ. There are a number of uterine issues which can block the passage of the fallopian tubes to the uterus. Around 3% of women are unable to conceive because of issues related to cervical mucus. This fluid is necessary in specific quantity and viscosity for sperm to be able to travel to the implanted egg successfully. Other prenatal and genetic defects aside from those related to the fallopian tubes can also inhibit fertility or increase the risk of miscarriage. Drugs that impact fertility in women. Spironolactone. This is a medication designed to treat edema, which can temporarily suppress fertility. The body quickly restores full fertility within a couple of months of the final dose. Neuroleptics. These drugs belong to the larger class of antipsychotic drugs and can impact fertility. Neuroleptics have the side effect of increasing prolactin levels in the bloodstream, which can contribute to reproductive hormone imbalance in women that can lead to anovulation or irregular period. Chemotherapy. Chemotherapy is designed to suppress the activity of cancer in an attempt to destroy the cancer or starve it out of existence. Of course, treatments that affect the cancer can also impact other healthy tissue, including that of the reproductive system, which can inhibit fertility. NSAIDs. NSAIDs are drugs like aspirin and ibuprofen that are designed to alleviate inflammation without the use of steroids. If used at high doses or on a long and regular basis, they can suppress fertility. Cocaine and marijuana. A number of illicit drugs also impact fertility, most notably cocaine and marijuana. Both of these drugs make it harder for a woman to ovulate, which inhibits conception. Both can also affect the development of the child, especially cocaine, which is associated with a number of prenatal abnormalities. Lifestyle issues that impact fertility in women. Alcohol use. Alcohol is a compound which influences hormone balance by promoting estrogen dominance. The abuse of alcohol is associated with a number of issues that impact fertility. For example, women that drink frequently are more likely to have their period without ovulating. Also, these women are more likely to have irregular periods, which affect their ability to conceive. Smoking. Smoking is associated with a number of issues related to infertility. For example, there are chemicals and carcinogens in cigarettes and other forms of tobacco, which can cause stored eggs to die off or degrade more quickly. It is estimated that being a smoker doubles the risk of infertility for both sexes, and that overall risk is correlated with the severity of the smoking habit. On average, women that smoke reach menopause between 1 and 4 years earlier than their non-smoking peers. Also, smoking affects the cervical mucus, making it harder for sperm to reach the egg in the ovaries. Exercise and diet. Fertility depends partially on healthy nutrition. Women that don't eat enough or eat too much can experience issues with ovulation. Women that are underweight due to anorexia or low body fat due to physical training can frequently miss periods. Being overweight or obese can also alter the normal hormone patterns conducive to optimal fertility. Age-associated issues which reduce fertility among women. As I mentioned earlier, women remain optimally fertile until their late 20s/early 30s. The specific age at which fertility starts to decline on average is around the age of 32. During the mid-30s, fertility remains quite high, but around 37, fertility starts to fall more rapidly. Doctors recommend that women 35 or older should see a fertility specialist if they are unable to conceive with their partner over the course of a 6-month period. If a woman is 40 years or older, they urgently need to see a specialist if they are interested in conception and are unable to do so in a matter of months. The overwhelming majority of women should be able to have children successfully at any point up to the age of 40, but beyond 40, and the odds start to drop at a rapid pace. There are a number of reasons for this. Hormone production starts to fall out of balance. Egg quality starts to degrade. The number of eggs available for fertilization starts to dwindle. There are also a number of physiological conditions which inhibit fertility, which become more likely with age. Female infertility treatment options. In vitro fertilization. For many women, in vitro fertilization is the best option for conception. In this process, eggs are artificially brought to maturation and drawn from the ovaries using a special needle. Egg and sperm are introduced in a laboratory dish, and the fertilized egg is implanted into the uterus where it then develops. Clomiphene citrate. Clomiphene citrate is an oral medication known as a selective estrogen receptor modulator, SERM. In particular, clomiphene suppresses the influence of estrogen upon the hypothalamus. It is used to promote ovulation in women that ovulate irregularly or are not ovulating at all. Clomiphene is administered during a specific period of every menstrual cycle in order to promote a normal reproductive cycle. Clomiphene has a high success rate, increasing the odds of conception to around 5.5% per month. If the patient does not conceive after 6 months, they are generally recommended to undergo other forms of therapy. Clomiphene is successful at inducing ovulation in 80% of patients, though other issues may still impede conception. Because clomiphene stimulates ovulation, it increases the odds of experiencing multiple pregnancies of 2 or more fertilized eggs. Repronex. Repronex is a medication which stimulates the production of 2 vital sexual hormones produced by the pituitary, which promote fertility and a normal menstrual cycle: follicle-stimulating hormone and luteinizing hormone. This form of treatment is often paired with human chorionic gonadotropin in order to maximize the odds of fertility. Repronex encourages the female body to produce eggs. Surgery. For patients suffering from reproductive irregularities or obstructions, surgery is often necessary to encourage fertility. The best example of this is with regard to the fallopian tubes. If these tubes are blocked, then sperm cannot reach the egg for fertilization. In the case of endometriosis, surgery can be used to remove thick areas of endometrium, which are inhibiting pregnancy. For patients with endometriosis, surgery increases the odds of successful pregnancy by 100%. Surgery is also used to eliminate a number of other issues that can inhibit fertility, such as uterine scarring, polyps, and fibroids. Elevated prolactin levels can inhibit fertility for women. Both of these have the ability to suppress prolactin levels, allowing women to ovulate in a normal pattern. For women with fertility issues resulting from elevated levels of prolactin, 9 out of 10 patients can have the condition alleviated through the use of these treatments. After prolactin levels have been normalized, 85% of patients return to normal ovulation patterns. Human chorionic gonadotropin. This hormone, also known as HCG, is naturally produced by the female body after the fertilized egg is implanted in the female uterus, encouraging the development of the placenta. HCG is a close relative of the luteinizing hormone, and bioidentical HCG therapy is often used in order to stimulate the production of luteinizing hormone at the appropriate point in the menstrual cycle in order to encourage normal ovulation and increase odds of conception.